What's up? Hey, Jim.
Hi.
I'm Jean Ross. I'm the CEO and co-founder of Primary Record. I'm super excited to have my neighbor and partner in crime, Jim McIntosh. Jim, would you like to introduce your role here at Primary Record?
Yeah, we haven't really done this. This is one of the first that we're doing here. So no, I'm the product manager. I'm the longtime SaaS guy, neighbor to Jean Ross, the powerhouse of advocacy and supporting people in healthcare. So I'm much more of the product guy, the technologist.
Well, so yeah, and Jim is phenomenal at taking my crazy amount of ideas and the problems I've seen as a nurse and directing them into a product that families can use today. Our mission is simplifying health information for families for better care. So, Jim, I wanted to have this moment, though, to have you kind of explain what you have seen, because in all of your years of product management, I don't know how many times I've heard you and our team chat being like, "Oh my God."
Right.
Because, we've seen how AI from a family and patient perspective, which is not really being done today, how when their data can be used to help them tell their healthcare story more effective. Just maybe walk us through about what you've seen and the challenges maybe we've had and some of the excitement you feel as a product manager in this space.
Right. So as we know, AI is getting a lot of attention right now. And a lot of times you get these hype cycles that are kind of a bubble and you don't really see the promise. The last one being cryptocurrency, the Bitcoin thing, blockchain. A lot of people saw the promise, but it didn't necessarily impact them on a daily basis unless they wanted to invest in it, right? So you saw a bunch of companies come along like that. And in my side role, and something I've done for the past few years, is due diligence for investments. So venture-backed companies seek out people with experience to kind of vet technologies that are coming along. And so I've been around and worked with, predictive analytics in kind of the B2C retail space. I've seen it from the big data aspects when I was at ExactTarget, a Salesforce company now. And so I too was skeptical when AI was coming out. I saw it as more of, hey, it's really just giving kind of that next best answer or something formulated based on, some learning that it's done. But what I'm saying now is, holy cow, when you apply it with the right set of data and you ask the right questions, what it can do for you would take years and years and years of programming the traditional way, which is tell the system this and then wait for the answer like that. And so this really kind of changes the whole landscape and actually makes it much more interactive and allows people to ask questions and follow-on questions that an engineering team or a software product could never really design for.
Well, and Jim, just to kind of interrupt there, like there's because I think that's always been a challenge in healthcare, especially with products or whatnot, right? Because it's like there's always this team engineers something, and then there's this white glove approach where they then have to change it for each new company or scenario. And I think that's what we're excited about is like, here is a place now, there's one place, there's a data representing a human being's life. Right. And now we can bring in this service to be able to quickly iterate is what I'm hearing you say, like, that ability to make me a report, in this way, or I don't know, just, right. But, you have probably done the most testing with our AI, and it's been funny to see the things. Can you just share some of the things that you put into our testing thing and have been blown away of what it's been able to spit back at you?
Right. So what Jean and I have in the product right now and what the team's built, it pulls in a lot of clinical information. So what are the medications? What are the dosage? Who prescribed them? What medical system did they come from? When were they prescribed? All of that, conditions, issues, problems, all of the more fact level information. Yeah, you can, I remember a while ago being amazed at you looking at just the clinical history as a nurse and being able to kind of paint the story. Oh, they must have been admitted to the ER. I see what was going on, but you knew how to interpret just the facts level, right? Mm-hmm. Now what we have is, our system has that clinical information, but what's really more powerful is people can load additional notes. They can load files. Maybe it's discharge paperwork. Maybe it's something as simple as recording an interview with mom or dad about what they want to do or problems they've had at a certain point in time. And all of that is fair game. So now you can actually ask questions across structured and unstructured content. And it's very, very different than the traditional search. And when I say search, it's a lot of like what Google says. Oftentimes, people don't really understand how is like the questions that I'm asking. When was my last MRI? The fact that you can just dump that into a box and ask it is kind of interesting that it comes back with a correct result, but that's really not any different than going to the section that you know is an MRI or would house an MRI or a procedure. And then looking for the very last one, or searching just on a text box. But what you can do with AI now is to say, what are the things I was doing around that period of time? What are the categories of medicines? So not just the name of medicine, but kind of an abstracted thing. And how did it potentially impact the next time I was I able to stay away from doctor's visits for more than 3 months? You can ask all kinds of story-oriented questions now and get rapid responses. And it's not like search. You can continue to drill into that with a follow-on question.
So I did what, I do a lot of volunteer work with daughterhood, and so much of the, so many things that I hear from daughters often is, I don't even know where to begin with questions. And so that's what I literally asked our AA thing is like, I'm a daughter. I'm just jumping into my mom's. I put all the information in. Tell me what I need to do. And it went through and it says, oh, like caregiving is a hard task. Like it gave me this whole, I'm so sorry, Jean. And then it said, I notice your mom is on a memory medicine. Make sure you're following up with the neurologist and keeping them up to date. I see that your mom has had frequent UTIs. Did you know that drinking water on a frequent, I was blown away as a nurse and as a person that's counseled many women of what this had the power to be able to do, right? And thinking about how families sometimes don't know where to begin with questions and how that could be the question that they start with to at least get them that next set of information. That was one of my favorite things that I've put into our chat.
Right. And then, when we're talking with those folks, oftentimes security comes up. Like, this is a big magic black box. What kind of concerns? Tell us, or just start off with some of the questions you're hearing around security.
Oh, so, because first of all, there's always this misconception. People are like, is this HIPAA safe? And so Jim, when people say that to us, what do you think they're actually asking?
They want to know that it's stored in a way that is not going to be accessed or shared with people that they don't want to have access to, that it's not accessed by people that would make a decision based on an outcome for them that they wouldn't want to be made. Maybe it's being denied for an insurance claim, something like that. It's also just, hey, maybe it's an embarrassing condition and I'm not sure if I want people knowing that I have this, even people in my own family. So that's what they're asking when they say, is it HIPAA? Because I think that there's a big cloud of understanding that it's a special type of data, but what is actually being done to secure that doesn't really prevent some of what I just described.
Correct. And then, and so describe what we have put in place, because something you don't advertise on your, LinkedIn profile is that you've been through the rigmarole from these large data companies of being that person that's in the hot seat on being a security compliance officer. Yep. And I think that's funny that you don't admit that that's in your past, but because you had that experience, when you started building the foundation of us, you already knew what we were going to be getting drilled on many years after that. And so tell a little bit about the things that have been on your mind as you built Primary Record and some of the transparency we've put into our system to ensure that families are kind of at the center of all of this. Yeah,
that's one of the pillars around transparency or information security. So with this type of data, it becomes a great responsibility, right? And so it doesn't mean that we can't have private companies invest the correct way with the correct technology. But those pillars that I talked about are, is the data being secured in the same manner that it would be if it was in a hospital system, with the same levels of encryption, with backup, recovery, auditability, who's accessing what, when, and why, the ability to recover, to keep it always current and present. So having rapid access to your information or the availability to it is a really key component of information security. And then the one that you talked about that we share in the product quite a bit so that people understand is extreme transparency. Like I said, who accessed what, when, and why. That's why when we set out all the data that we bring in, we source it, we know who added it, we know where it came from, we encrypt all of that, we use it for only those people with the granular level permissions that are needed, and then we trace who has viewed a profile, kind of the LinkedIn thing, but also tracking when changes are made and who's making those changes, so that you get full transparency, so that the day comes when you're inviting in not only just your neighbor or the nanny, but maybe a third-party healthcare system, you know what they've accessed, you know where it's gone, and you're the one giving consent to do so. So yeah, you can put in all the same security controls that are listed where people say that they're HIPAA compliant. One thing that Gene and I need to make sure people understand is that primary record's a new class of application. It is doing and managing personal health information the right way. And we're putting a lot of those controls in place, but maybe you can explain a little bit of like why we're governed by the FTC and not HIPAA.
I will get into that, but a word that I want to make sure people understand, because I know that this is a misconception too, is encryption. Because I know when we had we often have family members come and tell about, using our product. And I remember when Nicole was like, well, Gene, you can see my mom's meds. And I'm like, no, I can't. So people need to understand, we sign, privacy and security, with us. And like, we see, you made an account, like we see like kind of the things that will help us make sure we're giving you the right guidance in our application. But when you say encrypt, I guess, explain what that means, like what primary record gets to see from families.
Yeah. The engineering team, at my request and their best design, Alex does a wonderful job at designing systems, does it in such a way that we don't put the data in context where it can be identifiable if we ever see the raw value. So we're not seeing account IDs with things that would list a condition. We don't obscure or kind of obfuscate all fields, but where appropriate, we don't present information so that it can't be presented in the same way. That goes for API, that goes for in the interface, everything. So yeah, that they encrypt it so that only our systems can retrieve and present that information, and then working with authentication and authentication providers like Google to ensure you are who you say you are. So
no, absolutely. And then just to kind of go back to your question, the thing that you asked me was, because we're a family first application, or, a consumer third party. So like we're outside of this whole, we're not part of the business agreements and whatnot that HIPAA deals with, right? Because I always tell people, when you go to an office and you leave that office, HIPAA's in place, so a bunch of people don't get your information. But when you're taking that information and putting it into your own consumer application, HIPAA's like, that's on you. So you'll even see in some of when you go to pull data, as your right to pull data out of your patient portals electronically now, when you pull it out, it's going to say, oh, you're going outside of HIPAA. That's not to say that means it's not protected. It just means now you're in what Jim was describing, a new set of laws that we're governed by, which is the Federal Trade Commission. So a lot of people HIPAA, they just assume that's all that it is in healthcare. So I think us being so new, it's a bit of an education, but I have just really enjoyed this conversation. Jim, is there any last thoughts that you wanted to share?
I think maybe diving deeper in another one of our chats around what is HIPAA, why are we covered by it? So we won't try to assume that covers everything, but yeah, just know that the latest stuff that we're adding in with AI, with bringing in more inputs from your family, tracking, security, and we want to make sure that people can easily ask those stories or easily retell those stories in our application.
Absolutely, which that brings me to, I know we've seen there's certain governance that our patients are coming together to be able to kind of dictate what does AI look like for patients. So Jim and I have seen your groups, and we're excited to figure out how do we start working with these different patient advocates and whatnot to make sure what we're building is useful and without bias and all the things that comes with AI that I know a lot of people. But again, another can of worms that we will probably dive into much later. So, but thank you, Jim McIntosh.
Yeah, thank you, Gene.